Hello, everyone, and welcome to Looking Ahead, the post-COVID-19 development landscape. My name is Jeremy Southerland. I'm a senior associate at Ankrom Moisan, actually based in our Seattle office, but devoted to senior living and have been doing that for a very long time. I'm joined today by two others, and I'll let Alissa and Chris, you introduce yourselves.
Hello, my name is Alissa Brandt. I'm a managing principal with the interior design group at Ankrom, and my focus is on the senior living communities that we work on in-house.
And my name is Chris Ebert. I'm a principal with Ankrom Moisan Architects. I've been designing senior living for 15 years and thrilled to be here to share our thoughts with you.
Wonderful. Well, thanks, guys. So the format of today's discussion is we're going to sort of move from very big picture down to pretty specific details. And we're going to do that over the course of three sort of presentations. I'm going to start off by setting the context of the discussion. Then Alissa is going to talk about some cross-market trends that we've been seeing. I'll talk a little more about trends that we're seeing specific within our senior housing market. And then Chris is going to dial in a lot more into detail and talk specifics of trends that we're seeing within individual properties. So without any further ado, I'll jump right into the context. These are really unprecedented times for anybody working in the service of the aging. We've seen changing demographics, rewind pre-pandemic, and we all have been anticipating the boomers really flooding the marketplace. Well, that hasn't gone anywhere. It's still very much the case. Approximately 10,000 Americans every day are turning 65, and this trend is expected to continue until the year 2029, when the last of the boomers turn 65. So this huge market expansion remains absolutely forefront in the development landscape. Simultaneously with that, affordability and access have become also very, very big topics. It's kind of a huge affordability crisis for aging services. In the summer of 2019, some of you may remember NIC released a report called The Missing Middle. And I won't go into all the details of that report, but I will say that it indicates that roughly half of the middle income population is going to be able to afford care when they need it. So affordability, super hot topic. The COVID-19 pandemic itself, kind of a full year and a half now of social distancing, has really sort of intensified feelings of mistrust and added social barriers for a demographic that's already specifically susceptible to feelings of isolation and the anxiety and depression and all the other manifestations that come out of that. So I think the biggest challenge has been that maintaining safety can sometimes be in direct conflict with having one's social needs met. And so it kind of results in a trade-off with no real clear good choice, if you will. There's been a ton of divisiveness and navigating of misinformation over the course of the past year and a half. We live in a more connected world really than ever. We have communication with us with smartphones all the time. But with that, the discernment or the responsibility of discernment of information has really shifted to the individual. And that's really playing out in market expectations and the needs and or how people access information when it comes to the final end users of our properties. Diversity, equity, and inclusion have become huge. The civil rights challenges over the past year are likely familiar to a lot of the elders in our community. And then finally, technology has really taken off. The boomers have always been more technologically savvy than their predecessors, but the year and a half of pandemic has really amplified that and has really, we've been leaning into technological solutions in a way that we wouldn't have dreamed of just a few years ago. Why is all of this important? Well, it's because, at least in my view, and I think a lot of what we're going to talk about today is really pointing to this, is that the upcoming need for elder services is not going to be met through simply building more of what we already have. Meaning the future of the industry is kind of going through a really exciting change right now. And so we're going to try to get a glimpse of what that might look like by looking at some trends. There are three words that I always come back to when I'm looking at communities or communities specific to seniors, and that's the terms are community, expression, and resilience. And so I offer those up more as a backdrop than anything else for us to keep in our mind as we're going through this conversation. So with that, Alissa, I'll turn it over to you, and if you want to walk us through some of the trends you're seeing.
Sure. Thanks, Jeremy. Well, as Jeremy mentioned, change is now kind of the norm, and it seems to be happening at such an accelerated pace that it's kind of hard to keep up with what is new now and what's already outdated. So at Ankrom Moisan, we have a really strong commitment to staying current on research and trends, especially as they affect the senior living market. But we also operate in all markets, and that gives us a great look into the cross-market sectors and allows us to kind of track overall development trends that we're seeing. So we've pulled together a high-level look at some of the latest trends we're seeing and those that we think may likely have the most significant impact on the senior housing market, and hope that these trend highlights will be a helpful resource for all of us as we try to predict where the demand for services is likely to go. So the first topic is a broad look at housing overall. And the pandemic really created this kind of great American move where people everywhere started to move to different geographies. They maybe moved to the suburbs. They even may have moved back home with family. And this sort of big migration originally resulted in some decrease in rents and value in the major metropolitan areas, but also created substantial increase in costs in suburban neighborhoods. But rest assured that multifamily apartments in urban areas are on their way to a full recovery after a pretty challenging year. I read recently that investments in this sector are expected to reach $148 billion for 2021, which is a 33% increase to 2020. So developers are optimistic, and not only because of that, but there really is a housing deficit in some of these urban areas. And so, housing will come back in those, and the recovery will really likely be tied to tech companies opening up their offices in these markets and drawing back in lost renters. And so the other big topic for housing overall is affordability, as that's top of mind for everyone. So we see developers working with local governments and strategizing all different ways to keep rents low, while maybe earning property tax exemptions or looking at alternative construction methods. So moving on to retail shifts and trends that are evolving. The recent ease of the COVID restrictions we all had has left many booths facing shortages of goods and supplies because demands are really skyrocketing. So data centers and e-commerce sectors are reaching record highs, while brick and mortar shops are trying to reopen, but they're just struggling with supply chain, shipping, logistics, all kinds of things like that. We really learned that convenience is more important than ever, as everyone now is relying on technology to help assist some of their daily activities, which would be online shopping, meal delivery service, Zoom doctor appointments. I mean, the list goes on and on. We do see that the consumer mindset is shifting from sort of a global world perspective to a local view. And there really is starting to be a strong desire to shop local and support local communities, as we've all witnessed what global purchasing can do to local businesses and the local economy. And then this is no surprise, but the touchless experience, especially in retail, they're all on the rise and will likely be soon part of the everyday retail experience. I thought this was interesting that the QR code technology usage has increased 600% since March 2020. And that's not something I typically use, but I sure use it now when I go to a restaurant and look at a menu, and I have a feeling most of you do as well. So moving into workplace, because everybody's curious about how our workplaces will change, here's a couple of things I find worth mentioning. So there's a slow but really pretty steady return of employees into offices as the pace of vaccination increases. However, I think everybody will agree that hybridity is really the future of business. So employees ended up moving their offices to their homes, sort of really originally out of necessity, but they've discovered this newfound time that they've gained from lack of commuting and really like that. So they want to continue to work untethered, and they want the flexibility to work in various locations, various states, maybe even various countries. And they like having control of their schedule. So those who actually do return to work may do it maybe part-time, maybe 1 or 2 days a week, or maybe quarterly, but they will likely expect to have more flex space, more personal space, privacy for phone calls and focused work, and access to fresh air. Vaccination mandates are a likely requirement for returning to the office. And, ultimately, some degree of face-to-face interaction will continue to play a really vital role, most sectors in general. And so that really ensures that there'll always be a need for office space. However, the amount and the form and function of those spaces will likely be really different in the future. So we also are tracking some top healthcare trends. The three that I thought was most relevant right now to share with you is artificial intelligence. It's a huge catalyst for change in the healthcare market. And AI ultimately can offer the medical community faster predictive information. Some ways that I think we can see this being particularly effective is providing better patient treatment plans and medication management for residents, the consolidation and management of huge amounts of data. It can now be collected and sorted and filtered. And that can lead to providing diagnosis assistance by identifying, patterns in giant data sets of maybe genetic information and medical records. And that would allow companies to create new drugs really specific to particular illnesses and come up with treatment plans. The other area that we track, of course, is telehealth and telemedicine. This, of course, came in really fast when the pandemic struck and is here to stay as well as to expand. Patients are really reporting a desire to see virtual care, including telemedicine and remote monitoring tools continue. And, health experts are really suggesting that this is allowing people, empowering them to become proactive with their healthcare decisions. Lastly, there's the idea of the pop-up day health center as kind of a topic of conversation, and I'm particularly excited about this. Envision, kind of a roving bus or a day program where vans of service providers can deliver meals or possibly set up telehealth check-ins for seniors. And what's so great about this is that we could potentially no longer have to transport seniors to services because we can then bring the services directly to them. And we could even now consider delivering adult day health to isolated locations in rural communities and even connect seniors directly to affordable programs like maybe SHAG or DASH in the near future. So what does all this mean for senior housing? I think we can all agree that senior living is just being transformed, and the way that communities are being developed and designed and marketed and operated are certainly going to change. And I think we'll see that over the next several years. We'll start to see what that new iteration of senior living could look like. Holistic wellness is a very hot topic in the market, and we're likely to see this being experienced throughout the entire building rather than just in dedicated wellness spaces or suites. Wellness will really become part of the building infrastructure and encouraged as part of the residents' daily building experience. So everything that they do, from coming down from their unit to the dining room, may have some touch point of wellness in that. Healthcare has become a huge part of the senior living model as operators have increased their clinical capabilities. And they really shifted their sales focus from a blend of healthcare and hospitality to primarily focus on healthcare and personal care models, services, and definitely on safety. So, the resort amenities are still an expectation, but we're no longer seeing them as the first question that future residents ask about. So again, telehealth is here to stay, and we're going to start seeing, if we're not already, implementation of telehealth capabilities and dedicated spaces within communities added. We're seeing Zoom rooms pop up where care providers can assist residents with connecting with their doctors online or connecting to their families. Operators are really working closer now more than ever with hospitals and health systems, as well as bringing clinical staff and on-site clinics into the buildings for their residents. And the digital age of sales and marketing is here to stay for senior living. The good news is that this past year or year and a half now, seniors have become more familiar with digital platforms. And so navigating the digital experience is getting easier and easier every day. One interesting point to note is that operators really need to be conscientious of putting healthcare too upfront or in the resident's face. They really need to provide layers of support and service that are really personalized for each resident. And I think they need to continue to look for ways to reduce the social and the community impacts of future pandemics. COVID isn't going away anytime soon, unfortunately. And so having plans in place for times when maybe infection rates are high and low, that are easy to navigate and easy to assemble or disassemble, will be really, really helpful. So fortunately, senior living has already entered into a recovery phase as the world starts to rebound. But the industry, I think, will face challenges with what the perception of senior housing is by the general public. And how we reframe that perception will be a huge part of the upcoming transformation. What are some just really big overall trends that we're going to see? And here's just the top 3 that we wanted to share with you. Jeremy touched on DEI, or diversity, equity, inclusion movement. This is at the forefront of every conversation and design solution. And I would expect we'll continue to see discussions formed around designing spaces to create feelings of psychological safety with LGBTQ considerations, thinking about gender neutral restrooms. And then I'm already seeing a focus on designing for disabilities that aren't covered under the ADA. So neurodiversity and bariatric. There's lots of different options. And I think, we're going to try to address everybody to some extent. Symbiotic communities is kind of a new buzzword that you may have been hearing. And this is just reinforcing that shift away from global to hyper local. And it's really a strong desire to support local business. It fuels kind of a local solidarity and self-sufficiency, and really focuses on neighbors providing assistance to neighbors at a neighborhood level. It's really relying on ground up efforts to get stuff done in a time of crisis. And then, of course, research sharing, which we see quite a bit of in the senior living market sector, with maybe doctors' offices, clinics, and maybe even connections to universities. And lastly, technology continues to develop some really fascinating products. You may have all seen different variations of robotic exoskeletons that could assist seniors in particular with stamina and help them boost strength. There's gestural and haptic technology that are, working to create communication platforms to really humanize distance connections when you're not able to see your loved ones in person. So there really are a lot of really interesting ideas and technologies that are popping up every day as a response to the past year and a half. Many of them are really exciting and interesting. Some are a little bit crazy, in my opinion, but nevertheless, they all possibly are relevant to our lives in one way or another.
Great. Well, thank you, Alissa. I think a lot of what I'll talk about will actually seem a little bit natural coming out of the trends that Alissa just walked us through. I think in general, we're likely to see sort of a priority reset in the market. And that's based on a few things: the boomer expectations and choice, really trying to address access across all income levels and opening up the middle market. The use of technology, as you've heard many times over the course of this discussion already. But I think there's also a willingness and an openness sort of to new ways of thinking and new models that maybe hasn't existed up to this point. And then finally, I think that we're likely to see kind of a personalized approach to service delivery. Out of our cross-market research, we ended up hosting a whole lot of interviews with industry professionals kind of across many different industries, but the one specific to retirement housing, we actually were able to decipher or to analyze and sort of 5 key sort of trends sort of floated to the surface, and I thought we'd share those with you. The first being choice, personalization, and control. And there's sort of an expectation for more personalization, more choice, more control, and really technology is being used to really expand that. Also, new planning models, neighborhoods, and localism. And this is a lot of sort of echoing what Alissa was talking about across markets. This is absolutely applying to our senior living environments. A push for intergenerational engagement, holistic communities, and sort of socialization, and the need for social infrastructure within projects. Community partners, new service models, and cross-sector alliances. You'll hear me talk a lot about that here in just a few minutes. And then finally, as I've mentioned many times, really the equal access and equity, and really trying to open up senior housing and retirement services to this huge chunk, which is sort of the missing middle that's sort of falling through the cracks as it is right now. With all of that, everything that we're being asked to work with right now seems to be revolving around the idea of cost and how do we bring the cost of projects down, and a lot of that is to open that up to a broader market. As we all know, though, there are 2 pieces to the cost equation. There's the upfront development cost, and then there are ongoing operational costs. And so we're going to talk about those a little bit separately because our strategies for addressing them are slightly different. For upfront development costs, we have worked really hard with our affordable housing group in our office to try to optimize how do we get the biggest bang for the buck in terms of what we build as efficiently as we possibly can to really maximize the value and to minimize the upfront cost. And the graphic that's on the screen right now is a 7-step sort of checklist, if you will, that was developed alongside with our affordable housing group for sort of strategies to employ over a project to ensure the most cost-effective result. And the first being building a committed team from the beginning, choosing a development-friendly site, and that could be either a new site or it could be choosing a development-friendly portion of an existing campus. So we're really looking at that up front. Targeting value design. There's something that we talk about, which is an 80-20 rule, which is 80% of the cost of your building is actually in stuff that you don't necessarily see or touch. And if we can pull cost out of things like structure or plumbing, then all of a sudden, you get a lot of efficiency out of the design without any perceivable reduction in quality. Designing efficient and repeatable units. This has been absolutely key. And we have been working really hard over the course of the past year and a half to make not only efficient units, but efficient units that are specific to an aging population and senior-friendly units, using a lot of concepts for universal design and whatnot. Breaking everything down on 24-inch modules. It's a standard module of construction materials, and the more we can work to that module, it's fewer cuts in the field, it's less construction waste, it's just it makes for an efficient process all around. Asking trade experts means bringing in people who are going to ultimately be building the building and talking to them early on in the project and saying, hey, how do you want to build this thing? And it's amazing what you can learn from the incredible experience from the field just by engaging them early. And then really trying to streamline all jurisdictional approvals by trying to go through the path of least resistance. And we found that if you do these 7 things, then you are really well set up for having a much more efficient process that then equates to a much lower cost. We recently tested this on a project that we did with Reach Housing. It's called the Wise Plaza. And this is down in Portland. This is not a senior specific project, but it is absolutely an example of those 7 strategies put into practice. This project ended up coming out at about $130,000 a door, which was incredibly low. And if there was any doubt as to whether or not these strategies actually work, we feel really convinced based on the performance of this particular project that they indeed do. We're now we're working with Transforming Age and with SHAG to create prototypes for both an active adult and a mid-market product based on these strategies specific to, again, senior housing and how that might look. What an affordable product might actually start to look like. This particular conversation around affordability has become so important that we've even reshaped the way that we market ourselves. This is a map that we often use where the blue dots are all of our, sort of senior housing projects all up and down, primarily the West Coast. But you can start to see that we've started populating our map with also our affordable housing projects because cost has become such a major component to what we're building. I want to shift gears here for a moment and talk a little bit about the operational side. Staffing is, I don't need to tell anyone on this call that staffing is a challenge and it's also expensive. And we have been seeing more and more shift to, lower acuity sort of environments that require fewer and fewer staff to operate them. This particular graphic that I have on the screen is a chart I often use. And in the middle of it is everything that you would think of as retirement services, everything from the lowest acuity of community-based services and senior memberships all the way to long-term acute care hospitalization on the right, and everything to the left is more independent, lower cost, less jurisdictional oversight, and the opposite true on the right end. But the big change is the idea that everything to the left is really driven by choice and everything to the right is driven by necessity or by need. What we're seeing is everything pushing as far to the left of this graph as humanly possible. Active adult is absolutely on the rise, and really looking at deep dives into programming models that allow for maximizing amenity while minimizing the staff that it takes to operate that. A lot of what we're working with is sort of almost a Courtyard by Marriott model where you may have bistro type dining with a lot more self-serve, flexible spaces, club rooms and sky lounges that can be activated by the residents themselves rather than necessarily having to be staffed. And then taking advantage of amenities that already exist on the site and co-locating properties with services that are already existing, again, can work to minimize staffing models that are being provided within the buildings. This is a separate project that we wanted to highlight to talk a little bit about strategic alliances and partnerships. This was This is the Central City Concern Blackburn project in Portland. And it was kind of the example of strategic partnerships and alliances that come together. There were many different partners involved in this. There were 6 different health initiatives and 2 separate funding mechanisms that made this project possible. But this is it's a project intended to combat homelessness, and you have all these different functions in the building and residents, and it's a completely resident-centered design. So as residents sort of graduate from one floor up to the next, there are higher levels of services all within the same building. We think that this is probably going to represent a lot of the way that projects will start to emerge. Many different organizations and service providers utilizing different funding mechanisms to make projects that are based on the resident's experience and providing the care that a resident needs as they move up the system, regardless of who the individual organization is that actually provides that service. We're seeing, I talked a little bit about co-locating. This is another project called Reed's Crossing. This particular building is a joint venture between a wellness provider and a major healthcare provider to provide this wellness center that's open to the larger community. But simultaneously, we are working with another senior housing developer to develop independent living directly across the parking lot from this. So again, what I like to talk about is, or what I like to call the sort of borrowed amenity, if you will, to where we're finding clients looking for opportunities to build projects in a way that the amenities are provided to the residents, but not necessarily provided within the footprint of the building itself or within the operating agreement that they're providing under the contract for that project. And we're seeing this as a trend. We've got a new project starting up in Seattle where we're going to be co-locating a certain number of affordable housing units and physically connecting them to a center that provides adult day health and home health services. So again, we're seeing more and more and more of these sort of collaborations taking place. And I think we're going to see more of it moving into the future. Chris, I'll turn it over to you. Do you want to dial us into some detail here?
Absolutely. So, Alissa and Jeremy have been, kind of staying up at a high level and talking about some of these various trends and the impacts that they have. I'm going to kind of bring us down to a little bit more of a 5,000 foot level and talk about, the impacts on specific on buildings and projects really that we're seeing. So the first, we're going to divide this up a couple of ways. So the first is really the acceleration of trends or pre-COVID trends. So these are things that we saw, before we went into COVID. We think they're going to keep happening as we come out of that. That we've talked a lot about the technology gap without requiring, the pandemic requiring seniors to use technology in order to talk with their grandkids has really, closed that in a way that was, I think, unexpected prior. The renewed focus on healthcare and then prioritizing the autonomy of the residents. So those were trends previous, but we expect them to be sort of push more towards the front. And then there's some new trends as well, if we can go to the next slide, that we're starting to see. And so one of those is communities as healthcare coordinators. And Jeremy touched on this from a slightly different angle. And this is communities not providing medical care, but communities providing assistance to residents as the residents try and navigate their own care. There's also definitely a renewed appreciation for the interconnectedness of staff and residents. If staff is sick, they can get residents sick. If residents are sick, they can get staff sick. And understanding sort of that it's not two communities of residents and staff, it's one community. And there's understanding the importance of that interaction. Also being able to focus on adaptive response and resiliency. So being able to flex into different situations. The residents in communities aren't there just for the good times. They're there for all the times. And so being able to know and understand how the community and how the physical infrastructure deals with the bad times there's a renewed focus. on that for sure. And then, a greater appreciation on the contribution that the built environment can have on healing. I think we're seeing all of that. We've organized our thoughts around these using these 3 or 5, different categories: nourishment, light, air, fitness, and comfort. This really is a way to help us kind of think about and organize our thoughts on these issues. So the first one, nourishment and food. One of the things that has been a trend for a while is multiple dining venues. That's going to continue, but we expect that to kind of continue with a twist. In the past, it was not unusual for the various dining venues to share kitchens, share mechanical equipment, sometimes even share spaces. Now what we're seeing is that those spaces, we're looking at them to be more separate, so that if in the future the community needs to be divided up into cohorts, you can have one dining room that serves one cohort and one dining room that serves a separate cohort. And this is tied into a trend a theme that I think you'll see through a lot of these, and that is finding ways to use your dollars to solve more than one problem. So having multiple dining venues increases resident choice. It gives them more opportunities to control their own diet. But then it also can serve as a way to help keep residents safe during a pandemic or other kind of disease outbreak. Food delivery and pickup. This is we've seen that as I'd call it a spotty trend, but more and more it's becoming an official service that communities are offering rather than just sort of an ad hoc. And then one of the most simple things that we've seen is really being able to have flexible and movable seating. Things as simple as square tables instead of round tables allows the seating to be pushed together or pulled apart, just giving you much more bang for your buck, again, with the tables. So light and the impacts of light. So solar power, we're expecting that has really taken off in the last year or two, not directly related to COVID, but just as technology moves forward, the cost of the solar panels has dropped, as well as the importance of on-site power generation is becoming more and more apparent. Building codes really only address fire life safety issues. So we're now more and more being asked to figure out how do we power technology and computers and those sorts of things that need to be running for days and days, rather than just keep the emergency lights on for 20 minutes as people try and get out of the building. And solar is most definitely a part of that solution. Daylighting is also very important. The health benefits of daylighting are well known, but when individuals are not able to get out of their residence, being able to provide daylighting inside that can be able to benefit residents from the inside is also very important. And then circadian lighting. And so this is a technological solution. If you're not familiar with it, circadian lighting is basically color changing lighting, but not like a party color changing, not purple and green and pink and stuff, but it really, the intent is to match the color of the light as it changes throughout the day. And there's some preliminary research showing, benefits for staff, benefits for healthy residents. But the biggest benefits and the most well documented are in memory care, as we're seeing that having this daylight cycle inside the building can really help with issues such as sundowning for memory care residents. The next one is air. I'm not going to talk a lot about this one. It's fairly technical. There is a great webinar that Reese Hackman, mechanical engineers, did in March that talks about air and how to keep air clean. I'm just going to say one warning. If you're trying to deal with these issues, make sure that you work with a reputable mechanical engineer. There are some great filter products that use technology to filter. They can work really, really well. They don't make any noise. They don't make any sound. They don't give off any smells. They don't give off any light. You can just tell they're on because they have a little blinky light on them. Unfortunately, we have been finding, or we have heard reports that some people have been selling empty boxes with blinking lights. And so just, make sure that when you're doing these, don't chase the snake oil and work with a reputable engineer. So fitness and health. So outdoor access, the benefits of that I think are well known, and they have been well known. We can increase and do better about the way that we're providing outdoor access. Outdoor dining, I think, is a very obvious one and a pretty simple one to be able to achieve. But we've also looked at things like a physical therapy obstacle course, we called it. But really, that's using our landscaping dollars to build the landscaping in a way that it can be used as physical therapy equipment. So handrails, stairs, rough surfaces, those sorts of things that are out in the landscape. We would be spending money there to do something. So now we can spend that same money to get double value out of that. Also, I think overlooked with outdoor access is the visual access. For residents that can't leave the building or have difficulty leaving the building, and having windows to curated views. I'm sure that most of you can think of a spot in your campus where you've got a great big window that opens out onto some landscaping that would be amazing, except there's a hedge planted in front of that great big window. So all you see are spider webs and bugs and the trash that collects behind it. Those sorts of windows and views really should be designed and curated with the understanding that residents are going to be primarily experiencing them from the inside, and they can be designed in a way to attract wildlife and really make it a great experience for the residents rather than looking into spider webs. One of the other things that is also coming up with results to fitness, and that we've talked about already a little bit in the presentation, is telehealth. So, in individual campuses, the obvious sort of connection there is, well, you have to have the internet infrastructure to be able to handle, multiple video calls happening at once. But there's more to it than that. We're seeing a trend of people providing space for those places, either with just a simple, as Alissa mentioned, a simple Zoom room, all the way up to kind of more towards a remote exam room that would be staffed by an MA, where someone could sit in there on the visit with the resident. Someone can take vital signs and provide that sort of information. We're seeing some, I don't know what the official name is. I call them prescription vending machines, but it's, common prescription medications that are able to be accessed electronically or permit access electronically rather, on site, as well as just campuses providing note taking and monitoring that everything, all the technology is working. Comfort and emotional well-being is, again, something that's quite important. And being able to, increase transparency as residents are demanding more and more information about the way things are being run, and being able to communicate effectively both to internal and external shareholders will become incredibly important. Another part of this equation is I call it socialization, but it's just healthy social activities. And this is one that it's interesting to me because as a designer of physical buildings, you might think, well, how do we have anything to do with interpersonal relationships? But really, what we do with space is we create the opportunities for those social interactions to happen. And when we design places and adjacencies and those sorts of things, we provide the opportunity for people to have those experiences. We provide the opportunities for communities to form. And it becomes more, it's like planting a seed. You can't reach into the ground and pull the tree out of the seed, but you can nourish it and take care of it and provide the environment where it will flourish. And so that's, as we work through these, that's what we try and do. And then, as was mentioned, equity and belonging and providing services to underserved markets. Bariatric, I think, is an easy one that is becoming more of an issue, and we're being asked more and more to address bariatric issues in our designs. So I will definitely be able to see that continue as well.
Wonderful. Well, I think that it's safe to say that the industry is going through a fair amount of change right now. And I think it'll be really, really exciting to see what comes out of that. I know that we've spent an incredible amount of time over the past year and a half trying to paint a picture of what that might look like. And I hope that some of the thoughts that were presented today will start to point in that direction. All of our contact information is here on the screen. I hope that if there are any follow-up thoughts or questions, that you'll feel free to reach out to any of the three of us. We're happy to answer any questions and or have follow-up conversations as desired. And then we also will be on in the Zoom chat here for a few more minutes if anyone has any other questions that hasn't already been addressed or hasn't already been asked. Chris, Alissa, any follow-up thoughts from you guys?
Just wanted to say thank you for including us in this conference. We really appreciate it. And like Jeremy said, we love to see what's happening. We love to track it. We love to talk about it. So always feel free to reach out if you have some great information. Thank you.